Good afternoon. Thank you for attending this presentation. It's a 15-minute presentation. That's a brief orientation to advanced care planning with mental health in mind. My name is Susan Keller. I'm the director of the Community Network Journey Project, and I've been working on an advanced care planning supportive care project with behavioral health and peer folks for the last few years. This is part of the work that we've been doing. Today, what we're going to do is to have a brief overview to encourage you to learn more and take steps needed to help make your treatment wishes known and honored in a crisis when you are unable to guide your own care, or should that be the case for someone for whom you care. Before we begin, I'd like to tell you a little bit about the roots of this program. It grew out of a collaborative effort with these folks listed above here at a time when Goodwill was operating all the peer programs in the county. The need for this program was determined by clinicians with the older adult team of behavioral health, who found that there was no appropriate advanced care planning resources helpful for people living with mental health challenges. This program addressed that need by creating the new tools and trainings we will be talking about today. Peer centers that participated in creation of these new tools include those listed here on the slide. As we think about advanced care planning, it's important to recognize that hope is not a plan. Aggressive treatment is the default when there is no advanced care plan in place or no one to legally speak on your behalf saying what care should be provided. Healthcare professionals are trained to do all possible in a healthcare crisis when a person is unable to make their wishes known. Advanced care planning helps us to get the care we want when it's needed, in the place of our choosing, whenever possible. Advanced care planning is important because it helps us to prepare for difficult decisions ahead of the crisis. It gives instruction for care that reflects a person's goals, wishes, values, beliefs, and medical reality. Advanced care planning ensures a match between the patient's goals and the medical treatment provided, and it facilitates communicating choices to those who need to know, like our trusted advocates or healthcare agents, health providers, and so on, in times of crisis. And in this, of course, conversations are key. The advanced care planning continuum starts at age 18 with completion of an advanced healthcare directive. The advanced healthcare directive is updated periodically to stay current. And at any age, when diagnosed with a serious or chronic progressive illness, the physician order for life-sustaining treatment, or POLST, comes into the mix. The goal is that your treatment wishes are known and honored. Notice along the side there that word, conversations. Ongoing conversations over the years with your healthcare decision maker, your family, healthcare providers are very important and necessary to make this all work. And we'll talk more about POLST shortly. So what is an advanced care directive, you may wonder? It is a legal document used to appoint a healthcare agent or agents and generally specify what healthcare, including mental health care, should be provided if a person is unable or unwilling to make decisions for themselves because of illness or incapacity. The Advanced Healthcare Directive legally assigns authority to a healthcare agent or surrogate to make medical decisions and guide care when a person is unable. If no agent surrogate is designated, the Advanced Healthcare Directive helps guide healthcare professionals responsible for providing care when a person is unable to guide their own care. From a liability standpoint, the healthcare organization has more protection if they follow the patient's wishes as expressed in the Advanced Directive and by the health agent than if they don't. Not following the patient's wishes could open up the organization to liability for battery or negligence. So this has the force of law, and it's meant to protect people and to ensure that you get the care that you desire. California law provides that any person 18 years and older is presumed to have capacity to make an advance directive. The law presumes that patients and their surrogates have capacity. The fact that a patient or their surrogate is going against medical advice or makes, quote, a bad decision, end quote, does not indicate lack of capacity to make medical decisions. Capacity means the person has the ability to understand what is being said or done and make their own decisions. Or if the surrogate is acting on your behalf, they have the capacity to do this for you. So this slide tells you about the physician order for life-sustaining treatment. We don't go into this in depth, but it's important for you to know about this as a tool in the toolkit when doing advanced care planning. It typically is used for people who are seriously ill, where the doctor wouldn't be surprised if the person were to die within a couple of years. I'm not sure what that's about. So here you can see it's a portable care plan. It talks about the intensity of medical treatment desired in terms of life-sustaining treatment. And it gives seriously ill patients more control over their treatment. The Advanced Healthcare Directive is not a physician order. The Advanced Healthcare Directive is a statement of values and wishes and preferences requiring interpretation. POST complements the Advanced Healthcare Directive. It's an actionable physician order that's recognized by EMTs and hospital systems, health providers across the state. It's a uniform form. California law is very flexible about which Advanced Healthcare Directive form you can use, and there are many choices. Some forms are more user-friendly than others. Some forms are more legal and technology focused, while others are more focused on personal values. As I said in the beginning of this program, the Peer Pilot program created new forms to better assist those we serve living with mental health challenges. The Making a Plan Toolkit we will review briefly today was created with the help of mental health peers to address special needs of the peer population and those who are of service. This focus is what makes our documents unique among them all. To end this briefing, I'm going to do a quick review of what's in the Making a Plan Toolkit and invite you to attend a 1-hour program we have to learn more. For now, by way of introducing the Making a Plan Toolkit, let's take a quick look at the table of contents, which you received as a handout along with the overview of Advanced Care Planning Cornerstones before this class, or you can find on our website. So you see here in the workbook, it talks about making decisions, choosing the right person to help you to do these forms, somebody that's a trusted helper that can go through this and talk things over with you if that's what you would like to do. It covers personal requests about my care, making medical treatment choices in terms of what medically do we want done and what intensity of care in general terms. It talks about choosing a healthcare agent, who's best qualified, who can be and can't be a healthcare agent, and then gives some tips and resources that are just general good guidance and helpful. So that's the workbook, and the intent of the workbook is that a person would go through that with somebody, ideally, who they could talk things over and really think this through. And it's something that might take revisiting a few times before it may be completed. The workbook then helps to complete the forms that are a part of this toolkit. So the forms include the Advanced Healthcare Directive, which is a simple short form, a personal request form, which talks about more detail about our care wishes and also about our personal belongings and things that are more personal in nature that we want people to know about should something happen to us. And then the mental health supportive care plan is part of the toolkit also. And that comes with checklists or with open-ended questions. So there's two versions of that, and we'll be looking at that in the 1 hour session. We go through that in more detail if you would like to do that. So we would like to invite you to attend the 1 hour follow-up program that will walk through these materials to help you understand what's here and how to get it working for yourself or someone for whom you care. If you would like to get the Making a Plan toolkit or have a look at this all more in depth, please do visit our website. The homepage is up here, and it will guide you to the Advanced Care Planning with mental health in mind, tools and resources that I talked about today. And you can also contact me through the website if you have questions or want to know more information. And I could say my email is skeller@pacific.net if you want to correspond with me directly. Thank you for attending.